People often feel like they'll make others mad if they try to cry out for help, and people living with anxiety are often known as people pleasers. Because of these issues, people are being bullied for having this disability in their lives. It is found that anxiety disorders are the most common mental illness in the United States, and it's affecting over 40 million adults over the age of 18, or 18.1% of the population every year.
LGBTQ individuals are almost 3 times more likely than others to experience a mental health condition such as major depression or generalized anxiety disorder. The fear of coming out and being discriminated against for sexual orientation and gender identities can lead to depression, post-traumatic stress disorder, thoughts of suicide, and substance abuse. The LGBTQ community is at a higher risk for suicide because they lack peer pressure and face harassment, mental health conditions, and substance abuse. For LGBTQ people aged 10 to 24, suicide is one of the leading causes of death. LGBTQ youth are 4 times more likely, and questioning youth are 3 times more likely to attempt suicide, experience suicidal thoughts, or engage in self-harm than straight people. Between 35 and 65% of transgender individuals experience suicidal idealization. Someone who is faced with rejection after coming out to their families were more than 8 times more likely to have attempted suicide than someone who was accepted by their family after revealing their sexual orientation. According to the data from the National Survey on Drug Use and Health, adults identified as sexual minority were more than twice as likely as heterosexual adults to have used any illicit drugs in the past year. Nearly a third of sexual minority adults have used marijuana in the past year, compared to 12.9% of heterosexual adults, and about 1 in 10 misused prescription pain relievers, compared to 4.5% of heterosexual adults.
We all need to understand as a society that there are people living with this issue. It's not just the people you see as dramatic or too soft. It's everyone. I want people to understand that everyone in life is going through something, and we all have a story to tell about our past. And because of these backstories, we all have our reasons for having anxiety. I want people to know that it's okay to acknowledge the fact that you may be struggling. It's okay to accept your setbacks in life, and it's also okay to seek out help if you need it.
Mental illnesses and substance abuse within the LGBT community is not something to hide or be ashamed of. It is something we need to bring awareness to.